Welcome to the Benefits Executive Roundtable, hosted by Dorothy Cociu, President of Advanced Benefit Consulting. Dorothy is a nationally recognized benefits and compliance consultant and group health broker. Here, you will watch and listen to industry experts who will break down the latest trends in employee benefits, healthcare reform, state and federal legislative and regulatory activities, all designed to empower executive decisions. We are proud to bring to you all new for Season 6 video podcasts. We hope that you enjoy your new video podcast format, and please forgive any audio or video imperfections. Thank you for viewing and listening.
Hello, everyone. I'm your host, Dorothy Cociu. Welcome back to Season 6 of the Benefits Executive Roundtable. I hope that you all had a very wonderful and safe holiday season. I have with me as my guest today, Elizabeth Holman, who is the president of the Holman Group, which is a managed behavioral health care provider and an employee assistance program, or an EAP program, which is based out of Los Angeles County, California. Welcome back, Elizabeth. So glad to have you back.
Thank you so much. I was looking forward to this, and I think it's been a few years since we were together last, and a lot has happened.
I know it has, and that's why I wanted to have you come back. So thank you again for being here. As you mentioned, you were here before. It was Season 3, I believe, and we talked about the value of EAP programs in the COVID and post-COVID world. And as you recall, and probably a lot of our audience will recall, we all know that COVID turned everyone's world upside down in a lot of different ways. And the need to truly examine the mental health needs of employees and their dependents really came to light for really probably in a lot of people's minds the first time. And there were so many different things that were happening and daily stresses that we had never seen, never experienced before, right? With everything being done online and this and that. It was just so much happening and people working from home, and there was just a lot going on. So we had to be creative and try to figure out new ways to do things. And that includes in the healthcare arena, being able to move very quickly from, a brick and mortar type arrangement to virtual visits and so forth. And we really learned a lot about telehealth during COVID for sure. It seems hard to believe again that was 4 years ago that we were experiencing COVID. But it was a long period of time. It wasn't just a month, as we all know. And it really did cause a lot of additional stresses on people. So anyway, I'm just so glad that you're here today to talk about this and see where we are comparing then to now.
Thank you again for having me. Looking forward to the discussion today.
Thank you. So now we're beginning 2025, and tell us, if you will, what's changed since the COVID world in the behavioral health arena? What's going on there? I know that's a truly loaded question because there's a lot going on, but are you still seeing people virtually? Are people moving back to brick and mortar? What's going on with, the world of behavioral health now?
So that's a really great question, important question. For people who are searching for services and looking for providers, what they are finding is that a lot of providers are mostly delivering telehealth in the mental health space. And while there are some people that are adding back in brick and mortar services, they're adding in face-to-face visits. It's really more for certain situations, maybe the first time they see a child or a teenager, maybe a couple, to establish trust and rapport with the therapist, and then certain professions that are used to dealing with the public, such as first responders, hospital workers, people that are interacting with the public already, and those people never really got to go work from home. During COVID, those people still require in-person visits, based on the nature of their job and based on trust factors. They want to at least meet the person one time before they commit to telehealth later on. What some people are doing, though, we're finding is people are scheduling in-person visits and they are canceling them knowing that they can switch to a telehealth at the last minute. So we're seeing a lot of switching around, advocating for, I want this, and then really at the end of the day, it's a convenience factor. They don't mind not driving, not being in traffic. And there still is some anxiety and stress around interacting with people on a close quarters basis in person. So remember last time we spoke, the providers have to actually clean their offices in between visits. And this was more relevant at the beginning and during COVID, that they had to allow a certain amount of time in between visits. So while they're still cleaning their office, they're probably not as rigid. They're not requiring masks like they used to. Before, they were requiring proof of vaccination to see a mental health provider. So some of that has gone to the wayside. Obviously, cleanliness is, not negotiable for many individuals and their providers. So, I thought we would see more in person and more offices opening, and it's really a hybrid, 1 day a week, 2 days a week, or not at all. So I'd say about 70% are telehealth and 30% are in person.
Well, a lot of celebrities have come out in the past few years publicly addressing their mental health issues. And it seems that, mental health used to be something that we swept under the rug and we didn't want to talk about it. People were embarrassed about it, didn't like to talk about it. And now it's just easier for people to just ignore it sometimes. So it's really, really, I think, a good thing that the celebrities have done, saying it's okay to not be okay for the first time. It seems to have lessened the negative stigma around mental health since the celebrities have started doing this. What are your thoughts on that? Has that helped your industry at all, that people are actually talking about it now?
It has helped in some ways with certain industries that are sympathetic to what the celebrities are talking about. Or, give you an example. So those that are in the entertainment space or affiliated with, TV production, et cetera, there definitely is some understanding, some sympathy, empathy in certain space. In other spaces, yes, where we haven't seen it, we're seeing it in manufacturing, equipment. We're seeing a little bit more empathy and a preventative mindset that we don't want to get to this. Or if something happens in the workplace, they're acting quicker than they have in the past. In the past, maybe they didn't act at all. They didn't offer any time off, or they didn't offer counseling. And we're seeing more and more people offer counseling, after a traumatic incident. We are seeing also a movement towards resilience and trauma-informed therapy, where the providers are doing a lot of education. And if they're not getting the education at work or awareness at work, at least the individuals are getting, helped, informed by their therapists who feel that it is their responsibility individually, ethically, as a society, to give them additional tools that they may not realize that they needed, for resilience and self-care. So while it may seem back to basics, we have to remember that it all starts with the foundation, taking time off for ourselves, and then how that translates to the workplace. Now we're showing up, for some people it's taking a shower every day. It's, being used to working from home and, maybe working in our lounge clothes or our pajamas. And now we actually, I have to look for a clean pair of pants or socks that match, or, the right kind of shoes. And so people are now dealing with these types of stressors going back into society. So what the celebrities are doing is they're bringing, the critical elements to our awareness, though it really is up to all of us as a partnership between all players and all, healthcare stakeholders to continue the conversation, because the celebrity shock of what the serious, situations are is really just to get our attention, in my opinion.
Yeah, unfortunately, we've also seen a continued rise in serious mental health situations and issues, including an upward trend in suicides. And oftentimes, no one even knew that something was wrong with this person. We didn't know they were struggling. Do you think that the media putting a spotlight on this sort of thing is helping people to understand that they can ask for help? And is it really okay to do so? What are your thoughts on that?
I think, yes, I would agree with you that in some families, in some communities, yes, it will make it okay to ask how people are doing, and to know that just because somebody's happy, I think you take, there's a famous comedian celebrity that had passed away that appeared happy and dealt with the mental health struggles. And he actually, took his life when he was happy. He didn't take it on necessarily a downward spiral when he was unhappy. He did it in his opinion, he couldn't handle the highs and the lows and he struggled. And some people, just can't handle it even when people ask them how they're doing. That makes it worse. That increases the shame and increases the, feeling of hopelessness and despair, and I'm becoming a burden on others. So again, it really, in my opinion, and I think I've said this before in the season 3 podcast, that we have a responsibility to help people in the setting or the situation that we find them in. So whether it's a school, whether it's at work, whether it's at home, we are all stakeholders and partners. And somebody is not going to get better just by a family or a friend or a neighbor asking how you're doing. It's the repetitive, the 7, 8, 9, 10 times for it to sink in, because we don't know if it's, sitting at a eating establishment, if it's going to be at the car wash. We don't know where it's going to click and they're going to really feel safe and secure. But usually it's, building rapport, building trust, and the repetitive information. Because if it's just one time, I did my duty, I checked a box, and I gave them the crisis hotline, or I gave them information on the employee assistance program, or I let them know that they have mental health coverage once a year in an employee benefits meeting. If it's not repetitively brought up, in monthly trainings, in quarterly trainings, hearing it in repeat places. I mean, why do you think schools are so adamant about training parents? They can't just train the kids at school. They actually have mental health and substance abuse topics at schools these days. So if we're not doing that in the workplace, or we're not, talking about it repetitively at home, while what the celebrities are doing is great, but it needs to be on an ongoing basis, almost like a drip campaign, in my opinion.
Yeah, for sure. Well, obviously, suicide is a pretty dark topic, and I hate to start with that, but I really thought that it was important to help us to understand that mental health really can't be ignored, and it shouldn't be swept under the rug as it had been done many times in the past. Is there a trend of more and more employers wanting to expand their mental health benefits or add things like employee assistance programs where they may not have in the past?
We definitely have seen a trend during COVID that took off during COVID. Certain industries always added the mental health benefits, meaning that they needed it to be competitive. So your tech industries, your county, city, schools, they've always understood, based on the negotiated contracts, what the minimum mental health requirements were because of the nature of the job. Regular companies and, tech companies, anybody out there that wants to be competitive, has put in increased coverage. COVID has required them to immediately help people because they couldn't see them on a daily basis. They couldn't shake their hand. They couldn't look them in the eye. And people started not showing up on video during company meetings. Not only are you not seeing them in person, but they're not even able to turn on the camera. And that also shows a sign of, potential depression, I don't have the energy to even get dressed for this camera. Yeah, I can say it's a technical difficulty, but we can get on a camera on our phone. We can get somebody to help us. There's technical people that can jump on our computer and make the camera work. So it really shows the state of despair that some individuals are in if they can't even be on a camera in a meeting, unless it's I'm driving, I'm so sorry, I'm running an errand, or I'm in between picking up kids from school, right? That's understandable once in a while. But what companies are doing is they're actually trying to engage. So not only are they enhancing the mental health benefits, but they're, slowly increasing the engagement that's required. We went from hybrids to, requiring in the office, and, enhancing the mental health benefits is just scratching the surface. We are seeing people wanting to do more than just checking the box. It's definitely a trend.
Yeah, for sure. Let's back up a bit for the benefit of our audience. For those that may not be as familiar with things like EAP programs, can you explain to us just what an EAP program does in general so that they can understand a little bit more?
Yes, an employee assistance program is typically paid for 100% by an employer or your place where you go to work, the place of business. And it is something that is added to what's called the employee benefits package. So an employer might offer medical, dental, typically basic benefits. An employee assistance program is an extra benefit that includes free counseling visits, zero copay, zero money out of your pocket. It can cover the individual employee, it can cover their family, and it can cover dependents, and it can cover people living in their household. So the employee assistance program is the first tool. It can sometimes include a crisis hotline. It can include anywhere from 3 free visits all the way up to 10, 12, 20 visits. And usually there's a network, and the employee assistance program vendor helps you locate providers, appointments, services. They help with the crisis hotline. And then they might have community referrals for housing, getting food bank, diapers. They might help with 12-step programs for people that need it. And then other types of referrals, elder care, child care, legal, and financial. So it's a pretty robust program. And, a lot of people can go in for something that's not so personal. A lot of times they'll say, okay, well, I use the legal benefit, or I'll try the financial, or they'll feel comfortable talking about those aspects to other coworkers. But when it comes to saying that they used counseling, the benefit of it is that it's confidential. Nobody knows that they go just because work offers it. It doesn't go in the personnel file. There's no way to break that confidentiality unless harm to self, others, child abuse, or elder abuse. So other than those items, really the goal is to, keep those individuals safe. And then in some cases, they support human resources or the place of business to help strategize on bringing more tools to their staff for mental health topics.
Right. Well, our EAP programs, are these available during certain hours, or are they 24/7 type of arrangements?
So, most of the time, the employee assistance program for scheduling appointments or benefit inquiries, typically they're business hours. So just like you might call your dentist or your doctor's office, you're not going to normally schedule an appointment at 10 o'clock at night at your dentist and doctor's office. Sometimes there's, other ways to get a hold of those offices through email or instant messaging. The employee assistance program will typically have a 24-hour hotline, though, to talk to somebody if you need counseling or you're in crisis. Though for scheduling appointments and having services delivered, you basically would go whatever their business hours are. And it can vary: an 8-hour day, a 9-hour day, a 12-hour day, depending on which vendor you're working with.
Right. Well, if someone needs some sessions with a therapist, is there a number of sessions per year? You mentioned this briefly a moment ago, by type or condition or whatever. I mean, are they limited within the plan?
So typically the employer will select the number of free sessions that they would like. So it could be a 3 session, it could be a 5, 6, 8, 10, 12, 20. And that's the beauty of working with different employee assistance program vendors, that are on different platforms, have different sizes of networks. And, it's okay to have a really large network, but if none of those people have in-person appointments or those providers aren't accepting new patients, then seeing, 10,000 providers on the network, while that looks great on a spreadsheet, and in analysis, it doesn't mean that those people are actually going to be getting appointments. I've known a lot of people that have tried to even utilize their regular mental health benefits, let alone an employee assistance program, that call 3, 4, 5, 6, 8 providers for mental health appointments. And these are from both the broker and the human resource side, and they say they can't get an appointment. So what you would hope that the employee assistance program would do is, if they're going to say it's 3 or 5 or 6 or 8 or 10 sessions, you're going to hope that employee assistance program will actually advocate for you and help you guarantee an appointment.
What about the type of situation? That it doesn't matter if they have 6 sessions or 5 sessions or 10 sessions. What if they needed 2 sessions for this type of thing? And, maybe it was for having problems with their kids, but then something new comes up. How does that work with the number of sessions generally?
So, just backing up a little bit, because it's a really great question. It's a different answer depending on who it is, who the therapist is, and what type of therapy or style of therapy that they're using. So, we're like an onion, right? There's layers to us. You've heard that terminology before, that analogy. And, usually it's about getting to the root of the issue. So even if you have all of these different issues that come up, yes, you're entitled. Usually when there's a break in treatment, traditionally employee assistance programs will consider it a new issue once you've completed all the sessions and there's a break in treatment. So usually it's not just continuous therapy, 5 problems, 25 weeks in a row. That's not usually a break in treatment or a new problem. Typically, people who have stress, you can call stress anxiety. It can also be called depression. It can look like family communication. It can look like substance abuse or addiction. So whatever these surface issues are, they're still core issues that need to be dealt with. The easiest example I have is when you look at law enforcement or our veterans, people that have been in the military. What the surface issues are. We all know it. And what the core issue is. The core issue is a lot of times post-traumatic stress disorder, whatever happened in that environment that is not easily dealt with when they go back to civilian life, right? There's this disconnect about transitioning. So same thing with us as people. When we go through an issue, we think that we're just supposed to immediately be resilient and go back to work or go back to school or go back to the relationships, whether it be infidelity, whether it be dealing with an eating disorder, whether it be addiction. These are just masking the core issue. So if you have 5, 6, 8, 10 sessions, you can actually get to the core problem or the root of the problem, or, get to through the layers of the onion, so to speak, to deal with that. And then these surface issues are really great for 5 and 6 sessions. So, what I would say is if you are with the right type of therapist in the employee assistance program and you can get to a root issue of some kind, my own issues dealing with something that when I talk about it, I realize it's been going on. It's a pattern and it's been going on for many years. So it gets faster and easier to deal with ongoing new issues that come up, somebody passing away, somebody retiring, and I feel a sense of grief and loss, somebody leaving my job, even going to a new job, a coworker leaving. A lot of people feel grief and loss around those types of challenges. So, it really depends on what the issues are. And a good therapist and somebody who has trust and rapport with somebody can go through those issues on a quick basis instead of them having a more serious mental health issue. 5 sessions doesn't even work or scratch the surface. So I hope that helped in a little bit of a roundabout way.
Yeah, it did. Thank you. Well, the Holman Group is also a behavioral health care provider. Can you tell us more about that and the types of services that behavioral health providers offer, such as what you guys do at the Holman Group?
Yes. So a lot of people don't realize that, mental health has multiple levels of care. I think for the people that are watching, understanding that mental health is not just going to a hospital and being locked away or locked up like some people know. And it's not just about outpatient counseling. It's the whole spectrum or continuum of care in between. So when it comes to physical health, I'll give an example. A lot of people know what happens in the stages of, hip replacement, knee replacement, a broken arm, right? Most people know that there's something called physical therapy. There's something called, doctor's visits to check in on the status. There's stages of, if you're in a cast, removing the cast and, what that looks like. So if you think about mental health in terms of physical health, there are also those stages in between that people need. So you wouldn't have somebody who broke an arm, wear it for 2 weeks, the cast comes off and they're back to typing and driving and doing all that. But we expect that with mental health. We expect somebody who has had a significant event in their life, trauma, grief, a sick child, a sick loved one, even a pet, issues with a pet's health. We expect people to just bounce back. Mm-hmm. And we would give more kindness and compassion to a broken arm and a cast, or, even a heart surgery, or somebody going to the hospital for flu, pneumonia, bronchitis. We would treat that with more kindness, and we still do, and more acceptance of the different levels of care and what's needed, time off from work, et cetera, than we do with mental health. So part of it is education. There are different stages and levels of mental health where if outpatient counseling isn't working in a traditional behavioral health plan or mental health plan, there are things called intensive outpatient, where somebody might go by Zoom or to a facility. They might go 2-3 hours a day, 3 days a week, group and individual counseling. They might have access to a psychiatrist. Some people need this intensive help, but they don't meet the criteria for being in a hospital. There's also partial hospitalization, which is, 4 to 6 hours a day, 5 days a week. There's residential treatment where they sleep there and they try to get better for 2, 3, 4 weeks. And then there's hospitalization where you're not really doing counseling. You're just stabilizing, usually a medication regimen, depending on the reason that you went into the hospital in the first place. You're not really working on mental health issues. It's more of a medical stabilization, and then step down. It goes up and down depending on what somebody needs. So a lot of people don't know that all of these levels are available, and they think that it's just one end to the other. It's hospital or it's counseling. They don't understand the in-between stages. But if you remember the broken arm or the hip replacement or the knee replacement, then you'll realize that in the medical world, we have all these different levels of care. It's no different than mental health.
Well, has the behavioral health need increased in the past, say, 5 years, particularly since COVID?
Yeah, we've seen between a 300 to 1,000% increase.
Wow.
And that's numbers, based on all different organizations. There's, mental health nonprofits. There's foundations that have published all of this data depending on the environment. And I do have to say, for the underserved communities, there is still a disparity. While the need has gone up, it doesn't mean that they're actually getting access to care or the services that they need. So while there is such a huge demand and there's more awareness, we actually don't have enough therapists and licensed individuals in a lot of underserved communities.
Yeah, that's very unfortunate. We kind of touched on this before, but I want to come back to it. Another thing that began during COVID is that, we've gone from obviously working on site to a remote workforce. And that's something that's, a lot of people had difficulty with in the beginning. Now people are wanting it all the time. And it's almost like they have to have that, right? Because they got used to it for flexibility, picking up their kids, as you mentioned, that sort of thing. But remote workers still mean that it's a bit more difficult to know what's going on with your employees. And again, we touched on that a moment ago. They're not down the hall from you. You can't see them. You can't see the looks on their faces. You can't see if they look like they haven't slept and that sort of thing. So it's hard for human resources to really read what's going on a lot of times with their employees. And they're desperately, as you mentioned, the engagement part of this, they're desperately trying to engage with them, when they are remote workers. But, it's just not always easy to do. Has this workforce change been a positive or a negative thing related to mental health in general, working remotely, for example?
It's definitely a loaded question.
I know. Sorry.
And I think for some people, let's just take women, okay? And you mentioned picking up kids and all that. On the one hand, COVID set women back, 20, 25 years in terms of women. Women were the first to have to leave the workforce during COVID, okay, and have to leave schooling and go take care of, multiple generations. We've been shifting towards housing crisis and things being unaffordable, inflation. And so women have been the most affected with COVID and having to leave the workforce. Having people able to work from home, women are the majority of the people that actually work from home due to needing that flexibility of schedule. So, while women are the first to ask for help and be open to mental health assistance, there is a growing number of men, regardless of what setting that they're in, working from home, hybrid, working in the office, that there's still a stigma and a barrier to them getting help due to society, traditional roles of men and women, depending on which societies you're in, and, et cetera. It is really with COVID that we're seeing that, while mental health needs are important, in some situations, in some relationships within the workplace, why would they, a lot of people are more concerned about a IRS audit than they are, having somebody look at their mental health programs and do a checklist and an audit of what they offer, right? More people spend money on the IRS. And a lot of it has to do with their training and, what they're doing for their employees in general. So they could be concerned about computer training, the latest and greatest programs. Artificial intelligence is really big right now, and ethics around using artificial intelligence in the workplace and designating representatives, whether it's employees, legal, et cetera. Yet, we did see a surge in wellness programs pre-COVID where they had wellness teams, wellness committees, and that was the closest we got to really mental health hiding within a wellness program. Mental health was kind of like the parachute that we all needed, but we were still jumping off the plane, and the wellness program was the plane, and the person jumping off is the catalyst, and mental health is the parachute in this analogy. So, we're not really seeing all workplaces do check-ins and mental health awareness well virtually, but there are some that are doing it really, really well. And it is going to be those organizations that have more tech assistance, that with Zoom, they know how to do breakout rooms. They're having mental health town halls. They're having leadership come forward and talk about their vulnerable mental health or substance abuse situations and just kind of bare their soul and say, I just came from a program. I want to tell you that I support mental health. So until you have top-down support in an organization, it's not the fault of the working remotely or the working in the office. You can still have a toxic culture and not enough mental health support and things happening in the workplace, even if you're in person. So I don't see the setting as the scapegoat here, because I know some people that have work from home telehealth, 100% that do it extremely well. It's just a matter of, you're going to get a diversity, equity, inclusion consultant, a DEI consultant. You're going to have an accountant. You're going to have an attorney. Why aren't you having a mental health expert, even if it's your benefits broker? Why aren't you saying this has to be on my annual agenda? I have to make sure that I'm increasing by at least 1% my mental health awareness, my offering. I can't just offer the Band-Aid solution that's only in the medical plan. I have to do something more, because if I don't help people in my workplace, they're just taking their problems with them to school, home, when they're driving. There's so much increase in road rage. I don't know if you've noticed, but it's just, it's showing up everywhere. Yeah. We're kind of like, busting from the seams. We're bursting from the seams here with mental health.
Yeah, for sure. As an EAP program, are you able to reach out and help those HR teams, for example, and assist them in these situations? And if so, can you give us some examples on that?
So, yes. So our company, and there are a few out there that do it well also, they have management, consulting, and referrals. And they do what's called soft and formal referrals. And if an employee has issues in the workplace that are just starting to bubble up, depending on their culture, if they have a culture of helping, you want the employee assistance program to be seen as a tool, just like you would offer a training on a computer program, right? Nobody's afraid when you say, oh, we're offering this intermediate or advanced computer training, or we're offering artificial intelligence training. Nobody feels that as threatening or offensive or anything like that. So just like you would invest in technology and actual tools to get the job done, you would use these tools through an employee assistance program to help enhance what's going on and to remind people, while the problem is small, about self-care, about work-life balance, about boundaries, about communicating with an inside voice when you're talking to people, about business etiquette, for example, not typing in all caps, even if you're texting, not texting a coworker at midnight, that it's unacceptable, especially if you're the boss and you're texting the person that reports to you. They're going to feel like they need to respond and, oh my gosh, and I'm stressed out, and my work stopped at 6:00, but the boss is still working. So there's a lot of dynamics. So a soft referral, gently reminding people that the program exists, it's confidential. I'm not sure what's going on, but I noticed the other day you seemed upset, or you were crying, or maybe they asked for an increase in pay, or they asked for overtime. And so they wanted to make them a soft referral to the employee assistance program for financial assistance or counseling. A formal referral would be if, tardies, absenteeism, missing deadlines, yelling at the public, getting in scuffles with coworkers. So that would be more of a formal referral, referring them in, them signing a basic release of information, time off, work needed for attendance. Prognosis is fair, good, or poor. They don't get to know why they're in counseling, that they're really going through a divorce. They're dealing with grief, anxiety, depression. They don't get to know those details. They just know the basics. And so what we're finding is that some companies that offer those tools have a higher retention rate of their employees. They care about resilience. And they also, it's expensive to have to fire somebody and retrain a new person. It costs people an average of $155,000 to, $250,000 per position. The cost of lost work time, adding more work to other coworkers, them increasing anxiety and stress, the avalanche effect of that. So, these types of tools, looking for a full service employee assistance program that offers management support, coaching, consulting, whether it's training, whether it's referrals into employee assistance program, whether it's just holding the hand of the individual. I'm going to help you find this type of counselor that you'd like for a Saturday appointment, and I'm going to make it real easy for you to get help. I'm going to call around to 20 providers and make sure they're accepting new patients. So even if it's just that hand holding, you're helping management by helping the individuals that call in.
Yeah, absolutely. So beginning now in 2025 with planned renewal dates in 2025, the Mental Health Parity Act has a lot of new rules going into effect. Well, they've been around for a while, but they're now going into effect, so it seems very new to everybody, particularly self-funded employers and healthcare issuers or carriers, as we know them. One of the most cumbersome requirements is a non-quantitative treatment limitations comparative analysis, which is a mouthful, but it's also a very, very difficult process to go through if you are, one of the people having to compare these benefits and so forth, and all of these things that are going on that aren't easy to quantify, right? So anyway, they have to show all this great detail about their mental health program to make sure that it's in full parity with their medical surgical plan. And I'm going to ask you what I get asked all the time about EAP programs and mental health parity, particularly these rules, because like I said, as a matter of fact, I just recently updated, I want to update all my statements and so forth in EAP programs and reached out to you again for that. But if an employer has a self-funded health plan that's carved out, they've carved out their mental health benefits let's say since before 2008, when mental health parity was really starting to become more serious. Then they added an EAP program, a standalone EAP program with some basic services that we've been talking about for their employees. And, the question that I'm getting is that program subject to this comparative analysis, subject to the Mental Health Parity Act? And, there is an accepted benefit rule within the law. And do they meet that accepted benefits definition under mental health parity? So can you kind of fill in our audience about this? I know that you and I have talked about this before.
So it is a great question, and a question that we get asked a lot, more and more. As you said earlier, there's more mental health awareness. Well, the government is jumping on board and wanting to do their part of protecting people's mental health rights, access to care, network adequacy, payment adequacy, you name it. So in some ways it's becoming, very labor intensive to go through these things. And you really need a benefits expert like yourself who even understands that these exist and, that there's a deadline of, 1/1/25, on or after 1/1/25 for some of these things. And then, what the fines are, right? If somebody's not in compliance, what the liability is for this, and what's the likelihood of, them getting audited, et cetera. So, basically the self-funded plans have a lot on their shoulders these days because of this additional requirement. And some people turn to their benefits broker. They may turn to an attorney, maybe an ERISA attorney or a healthcare expert attorney to find out, will you do this analysis for me? Will you help me do this? I came across a really good checklist on the Department of Labor website for the MAPIA compliance. And a lot of it really made sense. I think if they had somebody like you, they had their, evidence of coverage, summary plan description, depending on what they call it and what they need. If they had documents like that and, all the players are involved in the conversation, then you could probably feel pretty confident about being in compliance if you had your checklist on your own. At the same time, there's so many things that are complicated that people are not aware of. So something as simple as prescription drugs, if all they offered is prescription drugs and they didn't offer a mental health benefit, they would still have to be in compliance with the, Mental Health Parity Equity Act with their prescription drugs. And there's such a thing that you and I know called step therapy, where you require them to try other things, other protocols, other brands, generic usually before they can get brand. And you require this before you're going to allow the prescription in there to keep costs. Well, there are mental health drugs. If the mental health drugs are also used for medical purposes, then you don't really have a target on it being out of compliance with the mental health drugs that you're using step therapy or a different approach for. So just being aware that, while we might love these checklists and we want to be in compliance, it helps to, look at some outside experts. The cost has come down significantly over the years. When I first had quotes, self-funded clients were looking for quotes. It was about $60,000 to $75,000 to do this analysis. And that's a lot of time. I mean, it's a lot of your time. It's a lot of my time. All the stakeholders have to be involved when this audit comes into place, and they may or may not charge, in addition to that expert who can sometimes be an attorney, a benefits broker, whatever, whoever's doing it. So, I'm just going to say that, we still have a long way to go. And until we have, unfortunately, fines and cases that they're willing to publish about, what's going on, or law, enough cases out there for us to reference, we're still going to really not know if what we're doing is correct, because it's really not one size fits all. It's my interpretation of the interpretation. So as far as the MAPIA goes and the compliance, as far as the employee assistance programs and their compliance under MAPIA, you have to prove that the EAP, the Employee Assistance Program, is an accepted benefit. I don't know. What do you think as far as that goes?
Well, the way I've read it in the law and the way, I've had podcast guests talking about this in detail just a couple of episodes ago as well. And they all seem to be in agreement that, well, not all, because there are a couple of attorneys that disagree, but the majority of the experts are saying that as long as it meets certain things within the definitions, that it can be an EAP program, can be an accepted benefit and not have to be subject to the analysis or anything else, because it is a standalone benefit. They limit the number of sessions if you don't go over a certain number and so forth. If you're making it like a regular mental health plan that you have, unlimited benefits, or you have, 50 visits allowed and that sort of thing, 50 sessions, then that's going to be treated like a mental health benefit within your plan. And that would be subject to the mental health parity, comparative analysis, and so forth, and all of mental health parity. But for the most part, they're saying that if it's just an EAP program standalone, with just a limited number of visits, including not only just therapy sessions, but also those other services that you recommended, and that in most cases, those are accepted benefits, but you do need to have somebody look at it, analyze it, and get an opinion that says that, this is an accepted benefit. And then they can feel comfortable knowing that. That's my interpretation.
I thought I'd ask because the biggest things is getting rid of the copay that I've seen traditional employee assistance programs that people have inherited in their benefits package have copays, some of the older plans. And so if there's cost sharing, I think that's one of the biggest red flags, for it not complying. There can't be any cost sharing. So I would agree with you. There's a lot of people that try to argue differently just to be more conservative or say that,
Well, it's definitely a gray area, and it's something that I think that you absolutely have to get someone to look at. You can't just assume that it's an accepted benefits. In a lot of situations, they are accepted benefits. But you can't assume that. You have to have an expert look at it. You have to have a legal opinion. You have to put that information in your file so that you feel comfortable in knowing, okay, we don't have to meet the requirements of mental health parity. So that's the way I always approach it anyway. So what should an employer be aware of when they're in that position, the number of sessions and so forth? Is there, in your opinion, just as a practitioner here and an EAP program, are there a number of sessions that you would say don't go above X because that would probably put you under the mental health parity rules? Is there something that you can kind of draw the line or refer them to and say, okay, well, we're considering adding an EAP program. We don't have anything right now. Should we limit the number of sessions? What would you tell somebody asking you that question?
I'd say, anything below a 20 session is probably okay. I'd say the 20 session and above, it's really about, have they eliminated their mental health benefits altogether and they're putting in this employee assistance program and they're not offering mental health. So that can be, usually I'd say the 20 sessions would be a trigger that's starting to look like an outpatient benefit. If it's below that, then maybe not, except I am still concerned if they have no mental health benefits below a 20 session, and that's acting like a replacement for a mental health benefit in their medical plan. So that's just something to be aware of that could raise some eyebrows.
Right. We talked a bit ago about behavioral health. There seems to be a lot more enforcement activity within mental health parity because of everything that's going on with these new laws going into effect and these new requirements. They're not new laws, but the requirements for the existing laws are going into effect this year. My guests in episode 7 were talking about that they felt that the federal departments felt that employers were basically asleep at the wheel and they weren't complying. And because of that, the federal departments really stepped up and ramped up their enforcement activities. And one of the things that they mentioned is that the number 2 most common situations where the departments are auditing is behavioral health. Those types of matters and that type of compliance. And they said number 1 was when they've already got an investigation going on. But number 2 is the behavioral health situation. They also said that part of the reason for that is that the typical behavioral health provider, that community has become very well versed in what the requirements are, what mental health parity requires, what the comparative analysis is all about, and so forth. And they've really become very educated on this because it's in their best interest to become educated, obviously. And they're not afraid to say something if they see that plans aren't complying. So, that means if they're saying something, somebody could be making calls to the department saying, I don't think this plan is complying. I think that they're having some issues here. They're not covering what they're supposed to be covering. I think that they're subject to these laws and they're not allowing that and so forth. Do you agree with that? And how do you feel about that within the behavioral health community itself?
So I would agree with you that that's definitely happening, though I'd say it's about 50% accurate when they do make those complaints or accusations. That some of it, unfortunately, has been bleeding into the understanding of medical necessity. Saying that you're out of compliance with the law when it really has to do with an individual case of whether they're medically necessary service for that care. Because society in general is becoming, more stressed, more anxiety, more depression, more substance abuse. We're seeing people that are waving that flag that you're out of compliance when it has nothing to do with that type of compliance. It has to do with medical necessity. So until we have more uniform medical necessity and that becomes a law to have some minimum standard, we're going to constantly run into these issues. And the audits will also be affected if they're outside of California. If you're inside of California, we have a law, that basically talks about the standard of medical necessity that's needed. And we've always been, first in line to have mental health laws in our state compared to the federal basis. That we're always richer or stricter than other parts of the nation. And you still have, at least 50% of the states that don't have a state, mental health compliance law. That the richest law is the federal law, which is still open for interpretation. So I would say that, just remember, putting my health plan hat on, is that there's a grievance process. Whether it's a provider dispute, whether it's a member grievance, you can file a grievance on behalf of anybody. You can be a provider filing a grievance. So start with the grievance process, start with education, ask for a copy of the, utilization management plan. And, ask for, even when you join the network, how do you authorize? Do you give one session a week for the entire year, or do you give 5 sessions at a time? Do you give 25 sessions at a time? What are you doing? How long can somebody go into a certain level of care? So I think if you're asking these questions, what do you think? Have you heard differently than that, or is this new information?
I've heard some of the same, but I wanted to hear from your perspective because you're in that. That's your. You're in that space. I'm not. I'm hearing it from the outside. I have some clients who are behavioral health providers, and so I've been paying attention to them and also they the kind of questions they ask me and so forth. So I think that that's why I wanted to ask you. But I think you're right on a lot of these situations. Unfortunately, that is what's happening, and people are just using the fact that there's this mental health parity law and they can grab onto that. And unfortunately, sometimes it's for not the best. It's not necessarily the best intentions, I guess. But there's a lot of true need there too. So I'm not going to fault that at all. But yeah, I think you're probably right. Well, the last time you were here, I asked you this, and I'm going to ask again because I think it's important. What message would you give to employees of employers that offer an EAP program and may not use it out of fear, out of embarrassment, or just lack of understanding what an EAP program really does?
So, it's a relationship, it's a partnership between the workplace and the employee. And I know I've said this before throughout the podcast that really it's about your culture. It's about, how easy is it for people to get help with tools to do their job? So if we realize that mental health is a tool, having positive mental health, mental wellness, that these are all good things, and it can help us be the best version of ourselves and, help the workplace with the return on investment for what we're doing. if we think about that, then the stigma should really start to fall away. If it is in our handbook, if it's in our culture, if every time we meet, we're sprinkling in a topic of the employee assistance program or self-care, mental wellness, we're raffling off a prize for a massage or, for somebody to, do something that's relaxation related. It's almost like weaving in wellness to help people feel less afraid or less stigma with asking for help or, receiving mental health services or even using the program. So if you're phrasing it that it's just like your annual physical at the doctor, it's your annual mental health checkup. That's all it is. There's no shame in that. There's no stigma. It's, you get the annual physical at the doctor for most people. You would get your oil changed on your car. You would fill your car with gasoline. You would inflate your tires if they were low. You would do all of these minimum things because it would interrupt your life so greatly if you had a flat tire, if you ran out of gas and you were on the freeway or in a remote area. You think about all these things. What about a checklist for what do I need to do to feel good? I want to feel good 51% of the time or more. And what's my checklist? Well, I need to eat. I need to drink water. I need to get a good night's sleep. And I want to have some type of human interaction. I want to have conversation at least once a day on the phone and once a day by text. So if you look at what are your minimum standards that you'd like, and you can work towards that. Some people may not have anything on that list, and some people may have 1, 2, 3 items on that list. So my advice is tell people over and over and over, what is the recipe or the key to making sure that you, the body, the person, can, be the best version of themselves. And there's no stigma or shame in the messaging if the messaging is said correctly. Mm-hmm. And you use the car analogy, you use, getting medical services. You're fine telling people that you're getting a physical. There's no shame in that.
Right. I think the way that you said that, though, was good because people can relate to that and makes it, puts it a little bit into more perspective, I guess, for most people that don't truly understand this, that there is still that stigma. But you're right. The way some of the examples that you gave are really good ways of, addressing it on a regular basis so that it's not something that they have to be, worried about and ashamed of. So I like the way you phrase that.
Thank you. Yeah, we use that a lot when we're doing open enrollment meetings, employee orientation, when we're launching the employee assistance program. We're saying it's basically your annual checkup. Mm-hmm. Your checkup just to talk about anything you want. All topics are safe in a safe environment. And reminding people that if you talk to a coworker, a family member about a fight you got in with somebody or how you can't stand somebody or so mad, you're going to get over it, move on. Your friend, your family member, your mother-in-law is still going to be mad at that individual and maybe treating them differently, and never let go of that. And, use it in situations in life. Whereas if you tell a counselor, a mental health professional, and you vent, it stays there. It's safe. It's not going to come back in your life and keep haunting you. So that's just something that a lot of people have told us over the years, that it's an objective third party that doesn't have an agenda in your life.
Right. Well, we talked about this a little bit before, but I want to come back to it. EAP programs aren't just for mental health crisis assistance. You do a lot of other things. You can help in a lot of other ways. Can you tell us about some of those other services that EAPs generally provide?
Yes, there are so many really fun and new services that have developed over the years. So, the legal and financial, so legal counseling, typically a 30-minute referral with somebody who's vetted. They make sure they're licensed and in good standing. They're an expert on the topic. Usually they'll have nationwide coverage depending on, who you're contracting with for an EAP. Some of the providers will offer a discount, maybe a 25% discount for hiring that attorney after the free consultation. Another service that a lot of people have is financial counseling. You really want them to do peer education with the expert, whether it be retirement, saving for going back to school, buying a house, even renting an apartment, understanding what those financial concerns and considerations are. Another thing that's real fun, part of the employee assistance program, are the discount programs. So they've really evolved. And, we had concierge plans early in employee assistance programs, work-life benefits that are still there, that are great, elder care, child care referrals, community referrals. The discount programs have evolved, gym discounts, training, different types of eating plan discounts, resources for weight loss discounts, and then, food delivery discounts, amusement parks, theater, hotels, travel. So because people stopped going to in-person during COVID, some of the vendors have added things like food delivery discounts and such. I can tell you that my kids and a lot of the younger generation, swear by food delivery. They try to get it at school. They try to get it at practice. They want to get it at home. They do it every night if they could, right? They just, I don't know, something about, using that app and finding a coupon and, they're just really excited about that. So the employee assistance program is a time saver. So if somebody's concerned about something, a family member in another state, an issue for somebody in their family or themselves, instead of, well, I got to squeeze this in my 15-minute break, or I got to squeeze this in on my lunch break, the employee assistance program, whoever they use for that service, can be working on it for 1 to 2 days for you and really get you a lot of times, 1, 2, or 3 referrals that might meet your budget, vetted referrals to help you, whether it's elder care, child care, a location to host a family event or a company event, some type of school, a special sports camp, theater camp for kids. It's fantastic. Once people use it for those topics, they're like, well, I've had this program for 10 years and why haven't I used this before?
Yeah.
I hear that a lot.
Yeah. Yeah. You even mentioned some things that I hadn't even known that you guys, that EAP programs offer. So that's good to know. Well, I asked you this a couple of years ago as well, but I'm going to ask it again because I think it's important because, again, I get this question a lot from employers. What types of employers generally offer EAP programs? Are there particular requirements in size, industries, et cetera?
Usually your larger carriers are going to have a minimum size requirement for an employee assistance program. I've heard some will go only above 100, and I've heard some will only go above 500.
Wow.
Our company goes down to 10 lives, and we've had a lot of people contacting us, all different types of people, agents, brokers, general agents that are interested in, looking for a program for below 100.
Can you tell me how private the EAP program is to plan participants? Does the employer offering an EAP program, do they know anything about why what they're using the program for? I think that, member privacy is very important. So can you kind of walk us through what they know and what they don't know?
So I'd say, at least half know that it's confidential. They know that, either when they're calling in, they're told from the posters, the brochures, it does say it's confidential. The employer might say it during an open enrollment meeting that it's confidential. And then sometimes they're hearing it from the therapist. The therapist is going over their right to confidentiality. So if they don't know it at one of those 5, 6, 7 times, they'll hopefully hear it and it will sink in and they'll trust it. That's the goal. And you have multiple touches.
Yeah, exactly. And the employer, what do they receive? They just receive a statistical report that says X number of people use the plan? What do they get?
Yeah, it's 5 employees, 5 dependents, for example, and these are the topics, and that's it.
Yeah.
No names.
Yeah.
Not even where they work, not a division name, nothing. Okay. Very simple.
And when you say topics, it could be like a topic such as what?
It's be generic, like stress. It could be generic, family communication, etc.
Okay. Good to know. Good to know. Well, I'm afraid that's all we have time for today. I want to thank you very much for all this really valuable information. And again, thanks for coming back and helping me with season 6. If anybody should want to reach out to you or the Holman Group, how would they do that?
So my email is elizabeth@holmangroup.com. Our website's holmangroup.com, and that's just the best way is email me to get a hold of me. And I'm on LinkedIn, though, and some other platforms under my name, Elizabeth Holman.
Okay, great. Well, thanks, Elizabeth. I really appreciate it. And again, thank you once again for being back with me in season 6. This was very, very helpful to our audience. Thank you.
Thank you. I really enjoyed our time today, and I was reminded of some really great points. And, I hope that everybody learned something today and find it very useful, because I know I did.
As did I. Thank you very much. To everybody else out there, please stay safe, stay healthy, and stay tuned for the next episode of the Benefits Executive Roundtable. Thanks, everyone.
Thanks for watching. Stay tuned for compliance tips, cost containment ideas, new trends, and decision-making tools. This podcast is produced by Advanced Benefit Consulting, Anaheim, California. All views expressed are those of the host or interviewees and not necessarily the views of Advanced Benefit Consulting. Information contained herein should not be construed as legal advice. We always recommend that you consult with your legal counsel as situations do vary. Ms. Cociu can be reached at 714-693-9754 extension 3 or toll free at 866-658-3835. By email at dmcociu@advancedbenefitconsulting.com or visit our website at advancedbenefitconsulting.com.